let's have a little look at the operations. Right, so it would appear that the... Alright, here we go. Did we answer that? I don't know. No. There you go. Right. Where were we?
Welcome back to Trauma Team Racing. My name's Scott, and if this is your first time here, let me introduce myself to give you a little bit of context as to what's about to happen next. I'm a trauma and orthopaedic surgeon based here in the United Kingdom, and I'll tell you a little bit about my journey to get right here today. I'm an orthopaedic surgeon with a keen interest in simulated racing, PC, flight sim, and all that good stuff, and generally just a bit of good old geeking out. I started my journey back in 2008 when I arose from a wonderful little secondary school called Mosslands in northwest of England. Here, I then moved on to do 5 years of medical school between the years of 2008 to 2013, where I sacrificed most of my 20s and watched all my friends have fun. I then moved on to foundation training for 2 years, whereby I went to East Cheshire and had a wonderful time. Then decided to take a year out to find myself, where I did some respiratory medicine, I did some trauma and orthopaedics before moving to South Wales and falling into core surgical training, which is what I wanted to do. From here, I then managed to get my post in trauma and orthopaedics, whereby I have been doing this for about 6 years now, 5-6 years, whereby hopefully the end game, touch wood, pending a small miracle, I will finish as a trauma and orthopaedic consultant. So, this brings us here today, the pinnacle, the mountain of all of that medical and surgical experience. We're going to put it to the test in Surgical Simulator Experienced Reality.
Alright, welcome to Surgeon Simulator Experienced Reality, and I got my hands, this is nice. So we appear to be in a waiting room of some sort of fashion, and as in atypical NHS fashion, the waiting room is empty. So right, it's got the controls, got a phone here, got some diazepam here. Right, you don't want that, that's an addictive benzodiazepine, so that can go away. Nope, not having any of that. Right. Let's have a little look at the operations. Right, so it would appear that the... Alright, here we go. Did we answer that? I don't know. No. There you go. Right. Where were we? Heart transplant. Right, let's give this a go. So I have absolutely zero experience of cardiothoracic surgery, so this will be somewhat interesting. Right, we've got our operation light. So the first part of any operation is make sure your lighting is good. Right, so you want each one pointing just over your shoulder at the operative field, so we've got a nice kind of view of what we're doing. We've got a dude, he's anaesthetized, he's got a nice mask on. It appears we've got some equipment behind us. Yeah, I can reach all that. That's good. We've got a video camera, but we haven't consented for recording, so we're gonna keep that over there, pointing away. We don't want to get sued. Got an extra of a dog, interestingly, over there. Right, we've got blood loss rate of 0 mils per second. It looks like we've got a total blood volume of 5,600 mils, and we've been going for 42 seconds. Now, we know we're doing a heart transplant. Right, so we've got a thoracotomy. The chest is open already, so someone's already been here, or I can't remember what I've done. Oh, we've got some... Wait, orthopedics, we've got a hammer. I don't think we'll be using that for this one. We've got scalpel, we've got a little jar or something. Right. Okay, first of all, let's get through the chest wall, right? So, let's pick our little buzzsaw. Right, now, gently does it. Want to avoid the skin edges, so we don't want any trauma. Right, so we want to get into the chest. Come on, sir. Ooh, shit. Right, so when we're cutting a bone, we call this an osteotomy, right? So we'll just osteotomize the ribs here. Alright. Making sure to avoid all the lung parenchyma beneath. Oh, I've got a bit of bleeding there. Oh, not good. We've got a bit of hemorrhage. Right. Gotta move quickly. The heart rate's moving up, it sounds like. So usually we would have kind of like done like a WHO checklist and make sure the patient's marked and consented, but this doesn't seem to be a reputable hospital, so this looks to be somewhere a little bit shady, and it's not completely sterile because there's blood all over the walls, and it looks to be fecal excrement on the ceiling, which also isn't good. Right, sternum removed. Right, here we go. Put down the side. Come on, down. Oh no, come on. Right, there we are. Right, next, lungs. Let's take the lung out. Right, so pop that later. I assume we've got to put that back in. And then we'll take that one. So let's put that over here nice and safely. Very good. And then so this is the liver. You can see all our lobes there. No vasculature and it's wiggling. Livers don't usually do that. Looks like a little slug, doesn't it? Ooh. Alright. Okay. Right. Time's of the essence. Don't want to drop the liver. Good, good, good. Right. 9 mils per second. Time is ticking. Right. So I think we've got to cut the stomach here. Alright. So. Okay. Right. We've cut the stomach. We can take that out. Come on. Okay, blood loss is okay. It's not letting me pick it up. Come on, you bugger. Good. Well, it looks like a little alien, doesn't it? Okay, right. Also been a while since we've done general surgery, so we'll put that down. That can go right there. Right. Time for scalpel time. Alright, so always handle your sharps correctly. It's not quite like this. This isn't the best way to do it. Do not drop it. Very good. Right, we got it. It's going through my hand, but we'll do. Now, we need to get to the heart. So can we cut this off? Right, yes we can. Right, so that's the esophagus gone. Right, this is not the classical surgical exposure to the chest. Right. Okay. So we've got a heart pumping away. It looks like we've got some pulmonary vessels and we've got an aorta behind it. The anatomical model is a little dubious. Do we cut here? Do we have a clamp? No, we don't. Okay. Blood loss is 11 mils. Ah, right, we're hemorrhaging, aren't we? Let's get to it. Good. Right, good. Right, good. Right, I think we've got the heart free now. Let's go. Right, heart's out. Okay, good. It's going everywhere. Right, fantastic. Oh, that's not how you do it. Ooh, almost dropped it. Right, we're good. Woo! Fantastic. Excellent. Party balloons, fantastic. Don't try that at home. This was not sanitary. This is not backed by the Royal College. And, yeah. Alright, cool. Right. That was heart transplant surgery 101, and apparently we didn't do very well. So, all that surgical experience didn't do me any good whatsoever. Right. I'll see you back in the room.
So, hopefully you enjoyed that. Hopefully we all learned something, and we'll be doing some more of them in the future, hopefully, because I had a blast. If you want to like and subscribe, all down below, drop me a comment, follow all these links, which should hopefully be flying around me right now, and I will see you next time. So good night, good evening, good morning from me. See you in the next one. So you might be asking yourself, did this guy really dress up in his scrubs and scrub hat in his own house in front of a green screen to do this video just to get clicks? Yes. Yes, I did. I regret none of it.